We're going to tape an AC joint or a coronary-clavicular joint today. Basically, there's a couple of things you need to use, and depending on where you are and what sort of products you've got, but I certainly like to use what we call Hyperfix, which is basically just an underlay that we use to help it just stick a little bit better. The other thing that we do use is Tough Skin, which is basically just an adhesive spray that we can use, particularly on guys or people that have got slightly more hair and stuff like that. But someone who had a hairy chest, I'd just ask them to shave. It was going to be a long-term thing. So we usually spray that down and then lay the Hyperfix, and I've cut some pieces already. I'd prefer to use the 10 centimetre wide Hyperfix. So just peeling it back, be careful it doesn't stick on itself, and then just using just above your nipple as a bit of a guide, all the way over to the back. We usually get a second piece if it's the 5 centimetre stuff. With the 10 centimetre stuff, the Hyperfix, it goes straight over the top. You only need one strip. And again, just peeling it back. Just overlap it slightly. And what we're trying to do is just cover the whole AC joint there. Okay, lay it down. Now the position that I like to, most people get them in, is just basically hand on hip. It just allows us to get the tape around the biceps area as well. So we usually use that as an anchor. And you're just going with the contour, so you're not going directly right around, you're going at slightly an angle. And I like to use a couple of those as well. And just make sure that you're not doing it too tight around the biceps. It can become quite restrictive. There's some blood vessels that go through there as well, so you've got to make sure that you don't do that too tight. Also put just an anchor. There's the AC joint there, and it's usually the knobbly bit just on the top point of the shoulder. Go slightly inside that and use that as a guide. And then from there, what we want to do is go straight over the top of that AC joint. So using our anchor bit there, and we're pulling it fairly firm and just laying it down right over the top of the AC joint down to the biceps anchors. And what we do is overlap by 1/3 to 1/2, and again pulling nice and tight and laying it down. And we're doing another stirrup to the rear or the back part of it and pulling over the top. So usually I'll do 3 of them, and then the last couple will just go at a bit of an angle, so trying to cross it straight over the top of the AC joint. So starting slightly over the back part of the shoulder or over the trap, pulling nice and tight and laying it down firmly. And again another one starting from the front, crossing over the top of that AC joint there. Now depending on what degree of tear there is with the AC joint, if it's a minor one, that'll do. If it's a slightly bigger step or more of a grade in terms of the tear of the ligament, and it's got quite a high step, then you want to put more of those anchors on, those stirrups on, sorry. Then just to finish off with, I'll usually just anchor that down right over the top, and just try and pull nice and tight. And at the same time, what you're trying to do is just put some pressure back down onto the AC joint and push that AC joint down. And then just finishing off with anchoring the biceps. Okay.